Hello, my name's Jamie Buchanan. I'm an orthopaedic and trauma surgeon. Over the last few years, we've merged Hastings, that's the Conquest Hospital, and Eastbourne Hospital's orthopaedic department. And so though both hospitals still have an independent functioning A&E department, anything which needs admitting from an orthopaedic perspective is admitted to the Conquest Hospital site where the emergency trauma surgery is carried out. Elective surgery continues to be carried out on both sites.
My name's Simon Hoskinson. I'm one of the orthopaedic consultants at Eastbourne District General Hospital. The orthopaedic department in Eastbourne predominantly manages elective orthopaedic operations, including upper limb, lower limb and foot and ankle, and also elective clinics. We also run fracture clinics every day of the week, and there's an accident and emergency here, and we deal with the ambulatory trauma.
When you are a registrar, you work together with a named consultant and you are part of his team. On this occasion, I'm part of Mr. Armitage's team, so I get to assist him and operate under his supervision in elective patients, for knees predominantly, and I see patients in both his fracture and elective clinics. As well as that, I am regularly involved in an ambulatory patients trauma list, which gives me the opportunity to maintain my trauma skills.
For the registrars, predominant work here is in the fracture clinic, the elective orthopaedic clinic and the operating theatre. The registrars are also on call during the day in Eastbourne from 8 till 5 p.m. To cover inquiries and ward referrals, but the majority of acute admissions are referred to the Conquest Hospital. The SHOs and the foundation doctors are predominantly ward-based work, managing preoperative and post-operative elective orthopaedic patients and a small number of trauma patients.
Hello, my name is Rebecca Morgan. I'm one of the F2s working on orthopaedics at Conquest at the moment. The majority of my time is spent either on call or on the ward work. Ward time is split between outliers, where you see patients on surgical assessment unit or paediatric wards, and then general wardware such as Benson and Edgerton, which are the main orthopaedic trauma wards in Conquest. We have an orthogeriatrician ward round almost every day now, which is very handy. They tend to focus more on the fractured neck of femurs because that seems to be where the majority of morbidity lies in orthopaedics. But we try to review every patient with the orthogeriatrician consultant every day. This is Edgerton ward, one of the orthopaedic wards along with Benson. Very busy ward generally, but they're all hiding. But this is where we'll do most of the ward rounds. You get 2 consultant orthopaedic ward rounds a week and orthogeriatric consultant ward rounds. So on call is spent nights, weekends, days on call admitting patients through A&E. You are accepting referrals from other hospitals, accepting referrals from GPs, which can be very stressful, but it's a great learning opportunity.
The consultants do a week each. So as you're attached to the consultant, you do a Monday to Friday, sort of 8 a.m. till 5:30 p.m. on call with them, and then you hand over to someone else at 5:30. So then on one of your normal weeks, you may have an on-call night. So generally at 5:30 you go around and see all the patients with the SHO, make sure you sort of clear the decks, so to speak, and then you're on call overnight, but that's a non-resident on call.
Foundation doctors and the CT grade doctors are not covering acute orthopaedic on calls, but they are part of the hospital at night team, which means that out of hours they cover various specialties including orthopaedics, urology and ENT emergencies.
From an educational perspective, I always find the 8 o'clock morning meeting particularly valuable. I learn from it every single day from my colleagues and also from my junior colleagues who've always got something to offer. Those meetings are extraordinary in the depth and variety of knowledge which becomes exposed to you.
We run monthly alternating sessions, alternating between a journal club and a clinical case conference. The clinical case conference is where patients come along and are examined in front of all of the department for complex cases or for training needs for the registrars.
In addition to that, there's bleep-free teaching for the foundation year doctors. The registrar doctors are encouraged to go off on various courses, whether it be trauma or elective surgery, depending where they are in their training. Two of us here, that's myself and Guy Selman, are examiners for the FRCS Trauma and Orthopaedics, and therefore when we're doing our clinical meetings we tend to run them as a mock exam.
There are grand rounds, there's geriatric teaching that we're encouraged to go to. There is FY2, FY1 teaching as well, set on Wednesdays and Thursdays. We're encouraged to go to theatre as much as possible. So every morning in the trauma meeting, the consultant generally say who's coming to theatre in the afternoon. And as long as we're well staffed, one of the juniors should be going to theatre. If you ever get a moment, you can always go to Fracture Clinic. They're very receptive to teaching, educating the juniors, because ultimately we are the ones that are admitting these patients, so we need to know exactly how to manage them acutely.
There are ample opportunities for trainees to be taught both on the ward and also in the clinic environment and the operating theatre, and all trainees are welcomed and encouraged to attend clinics, fracture clinics and operating lists. So we actively encourage junior doctors to request feedback, and we'll give feedback when they request it, but also there's a structured arrangement for clinical and educational supervisors for formal feedback, both from the trainee to the supervisor and vice versa.
Yeah, I do feel supported. When you're on call, there's always a registrar on call. Over the days, the registrar is in the hospital, but they may be in theatre. But all of the registrars are happy to be contacted if necessary. Those in Fracture Clinic are right next door to A&E, so you can always ask them to review an X-ray if possible. But there's always a registrar available in the hospital during the day. Out of hours, it gets a little bit different because the registrars are not on site, so they go home. However, they've been very, very supportive. You always get their number before they go away, and most of them say, call me for whatever. They'll review X-rays, and if necessary, they'll come in and see the patients. If not on call, just during the ward days, thankfully we have the orthogeriatricians now, so the consultants are generally on hand. One of them stays in the hospital all day, but is based on other wards, so if necessary, I can escalate to them.
The junior doctors at the ward, as well as the nursing staff, they know who we are. The registrars, they've got our phone numbers and they know what our planned clinical activities for the day. So essentially, at any point that they feel they want to talk to us, they can either call us, physically come and see us. The hospital is not that large in expansion, so people can actually come and see us for any questions they have, and we will be more than happy to go and assist them and go and physically do what they want us to do.
The whole nursing cohort are amazingly supportive. They have so much knowledge, particularly in orthopaedics. They know what they're looking for. If you're worried about compartment syndrome, these nurses are very senior. They have seen a lot of orthopaedic patients complaining of pain. They know what is worrying and what is not, and you can often turn to them. Pharmacists, great on the ward. They're always available and they're always really willing to help. I found the physios and OTs, they're a brilliant team. And yeah, the sisters and the matrons, everyone is trying to help you to do the best for the patients and to speed up as much as possible.
I'm Trish, I'm one of the two sisters on Hailsham 2 elective orthopaedic ward. Main thing that we want from the junior doctors is on the day of the patient's admission, if they go down to the admissions lounge, talk to the patients, write up their normal regular drugs so that they're on the drug card, ready for when they come back to the ward. Then when they come back to the ward, just to go through with us and review that they've got enough analgesia. We're really, really keen on laxatives. If you write laxatives on day 1, I won't be asking you and harassing you for suppositories on day 4, and you'll have a happier patient. We're also really keen on TTAs, to get them written as soon as possible, and particularly on a Friday afternoon you'll see steam coming out of my ears because we have no pharmacy on a Saturday morning, so it's really important, even if the patient isn't going till Sunday, that we have the TTAs written. We're a really nice team here, really friendly, and we're happy to help you with anything, so don't be worried, just ask away and we'll share our experience with you.
Hello, my name is Kate Weatherly. I'm a specialist orthopaedic physiotherapist. I have 2 roles in the department. largely seeing all the patients after total and partial knee replacement and total hip replacement, either elective or trauma, for their 6-week and 6-month post-op follow-ups. I do this on behalf of the surgeons. So if anyone has any queries relating to patients post surgery, they can come to me.
My name is Amelia James. I'm the matron in the Orthopaedic and Trauma Outpatients at Eastbourne District General Hospital. I run the trauma and orthopaedic outpatients, fracture clinics, elective clinics. We work very closely with the casting department and we work together as a team. We have junior, middle grade and consultant clinics. It's a team effort. Everyone is as important as everyone else.
I'm Trainee Thompson. I'm matron for orthopaedic outpatients here at Conquest, and that covers the fracture clinic, outpatients, clinics and the pre-assessment department. I have Angela Barnes, the sister who runs the fracture clinic and outpatients clinics, and I have Claire Harrott who runs the pre-assessment clinic downstairs. The nursing staff are key in supporting the doctors and new trainees, their learning.
Hello, my name is Sarah Franklin. I'm the matron of Trauma and Orthopaedics here at the Conquest Hospital. We have 3 orthopaedic theatres, all with laminar flow. Theatre 5 is our trauma theatre, and we use that 7 days a week from 8 o'clock till 6. So I'd imagine I would see you there predominantly. There'll be lots of things that we'd talk to you when you get here, and we look forward to meeting you when you come.
As part of our team, we have got 2 physicians who are loosely termed orthopaedic geriatricians, who really work in our department to help us manage the medical problems, which are complex and varied, associated with the extraordinarily elderly population.
Mrs. McNally, one of our orthopaedic consultants, has produced and regularly updates an orthopaedic department handbook, which contains all of the relevant orthopaedic information and is a vital resource for the junior doctors.
Hi, my name's Mika Henderson. I'm the Trauma and Orthopaedic Administrator. I'm based down on Egerton Ward, which is on level 1. You'll find me literally just in the office on the right-hand side. I do all the rota coordination, so if you want to book any annual leave or study leave with me, you can come and find me and book that. Ideally, we always look for 6 weeks' notice for any leave that you would like to book. You'll normally see me walking around on the wards, on both wards, Egerton and Benson wards, so if ever you need to find me, then I'm always around.
Hello, my name's Louise Simpson. I'm the administrator for the hospital night rota. The rota is made up of 13 doctors, 6 from urology, 4 from orthopaedics and 3 from ENT. The hospital night rota varies of night shifts, long days, 0 days and weekend shifts. Obviously, if there are any other queries, questions or anything like that, we're always happy to help, so just come and find us and we do the best we can.
The registrars are a big friendly group. Everything's organised via a WhatsApp group, and that's for social occasions, but also for rota planning and changing the on-calls, and also covering lists in elective clinics and fracture clinics when necessary.
I've never worked in a hospital where I've been so proud of my colleagues and have enjoyed working in such an environment. I think as a trainee here you will find yourself embedded in a department which is hugely efficient, extremely functional from not just a medical but also a personal perspective, and there is a great deal of hard work, but I think you'll find it in an environment where it's met with good humour.
Perhaps a little nervous when I came down, but was made to feel really at home. I've made some good friends. I've really enjoyed working in the department. Everyone's really friendly and approachable. And I've actually enjoyed living in Hastings as well.
Actually, it's been the best rotation so far. Because I'd like to go into surgery, it is the only rotation where I have really been included in the surgical team. I have gone to theatre a lot. I have been helping, scrubbed. Every time I go to theatre, I am assisting. I've even managed to do some minor operations myself. So for people who want to do surgery, it is a very hands-on, inclusive rotation.